Hello and welcome back to Unacademy. So let's crack NEET PG. Myself, Dr. Muskan Chaudhary, and we will cover about the previously asked questions from the Neisseria topic. All right, so Neisseria is very important topic. One question has been asked this year only from that topic. So, starting with Unacademy, as we know that Unacademy is India's largest learning platform where you get both the live and the recorded sessions, mainly beneficial for those students who are doing the medical, who are the medical officers and are preparing for the NEET exam simultaneously, and they do not get that much of time to record their sessions. So, do not get time to watch the live sessions, can actually watch the recorded sessions learning from the India's topmost educators because an academy has a number of educators who are excelling in their own work and who are great educators having a great communication skills with the students and making out the basics concepts clear with the competitive T&Ds, and you can analyze your performances and your evaluation, the examination for the examination that you're going to prepare, because an academy is not only providing you from NEET PG examination, but also for all the other competitive examination, whatever you name it, and you are here on the Unacademy. You can assess up to 25,000 of the MCQs. We need to do around 15 to 20, 50 to 100 MCQs per day, and we need to cover 18,000 MCQs at least. And soon the printed notes will be available. Now, in iconic subscriptions, the Unacademy has come together with the Prep Ladder, and we know that Prep Ladder is very famous for its rapid revision courses, for the QBanks, for the video lectures, and for the clinical as well as integrated essentials. All right, so well-structured live basis from the Unacademy, and competitive T&Ds with comprehensive and the printed notes, and the Q banks with recorded sessions, and well-structured live batches from the Unacademy. Now, I will recommend for those students who are on the second year and third year to have at least 4 year subscription so that you can have enough of time period for your preparation and you can perform well in the examination, because once your basics are clear, you will never forget it. With 12 month subscriptions, we get 2 months totally free, and with 24 months, we get 4 month subscriptions totally free. All right, and an academy is a great platform to help you prepare for the examination, and it is very economical and cheap compared to other uh, platforms. Now there has been hike in the icon subscriptions from 1st of October, that for 12 months it will be costing you around 52,000, and for 18 months it will be costing around 57,000. For 24 months it will be costing around 65,000, and for 3 years it will be 75,000, and for 48 months it will be around 85,000. All right, so please do use my code, that is Muskan10, to get 10% of the discount, and please enroll into the Unacademy and use my code, that is Muskan10. All right, we'll come with the Neisseria gonorrhea and Neisseria meningococcus. We know they are what? They are what? They are gram negative coccus. They are what? Gram negative coccus. Although all the coccus are the gram positive, but exceptions are there. Neisseria, that is what? Neisseria and Moraxilla, they are what? Gram negative coccus. Now, what is the main difference is that we need to remember Neisseria gonorrhea, the portal of entry is what? G4D, that is the genital tract, and for meningitis, it is what? Nasopharyngeal and the respiratory tract. Now, please remember this, that Neisseria gonorrhea, they doesn't have the capsule, while meningitis is what capsulated is very important. Is what capsulated is what capsulated. Now, beta lactamase is present in some of the Neisseria gonorrhea, and remember this, that G4G, that it will be what show the glucose metabolism as well as the Neisseria meningitis, but it also has M. So M for M, that is maltose fermentation. It is what? Maltose positive. All right, vaccine is not yet available. Vaccine is not yet available for gonorrhea, but for Neisseria meningitis, the vaccine is available. Just a second, I'm getting call from the department. Sorry for the interruption. Now, the vaccine is not yet available for the Neisseria gonorrhea. While for Neisseria meningitis, we'll study about the vaccination. Now, these are what Neisseria gonorrhea, these are both, they are what Diplococcus, they are what Diplococcus, but Neisseria meningitis is what capsulated, okay, is what capsulated. Neisseria gonorrhea is having numerous pili that is helping in the addition as an additional violence factor for the Neisseria gonorrhea. All right, and Neisseria meningitis is what half moon shaped or lens shaped, and G for G like this, they are what? They are kidney shaped. They are what? Kidney shaped. All right. So first talking about the Neisseria meningococcus, we'll just revise the topic. Neisseria meningococcus, what is the valence factor for the Neisseria? Now, one is what we know that Neisseria meningitis is what capsulated. It is what capsulated. So capsule we know it is what an antigenic, and it will additional valence factor that is inhibiting the phagocytosis. 13 serogroups are available. That and most common is what A. Most common is what? A. Now, endotoxin, we know it is what a gram negative, and gram negative does have the outer membrane proteins because outer membrane is present in the gram negative. Remember, one is the capsule, very important that they are capsulated, another because they are gram negative. Gram negative has what? Outer membrane. Outer membrane has what? LPS, and LPS what has endotoxin. All right, it differs from the LPS of enterobacteriacin, linking the repetitive O side chains, produce generalized Schwarzman reaction and Waterhouse-Friderichsen syndrome. Very important. Please remember that Waterhouse M को उल्टा करेंगे तो W आएगा. That is Waterhouse-Friderichsen syndrome is a complication of Neisseria meningococcus. Other than this, they are having very important, that is a IgA protease which is present in both Neisseria meningococcal and the Neisseria gonorrhea. Endotoxin activity is also present in the both, but meningococcus is one is difference is that it is capsulated. Another is what they are having what and that they are capsulated. One difference is that pili that is helping the addition. It is mainly present in the Neisseria gonorrhea, and it is mainly main factor for the violence in that of the Neisseria gonorrhea and outer membrane protein. Now, what is the pathogenicity? What is the pathogenicity? Most common group is associated is A and E with the pathogenicity, and they cause epidemic disease mainly in the sub-Saharan Africa. All right. Now, Group B has a propensity to cause hyperendemic disease. Humans are the only reservoir. Humans, very important. Please remember, humans are the only reservoir, and humans are the carrier. The most common source is what? Humans. That humans are the most common source. And what are the nasopharyngeal carriers? The children are mainly the nasopharyngeal carriers for this. Now, humans are the only reservoir, and humans are the carrier. They are most common carriers. And what is a carrier in this? That is a nasopharyngeal, and mainly it is what? Children's age group. All right. And mode of the transmission is what? Because what it is a nose, that nasopharyngeal carrier. So obviously the mode of transmission will be droplet, and the most common route is what? Hematogenous, and then the olfactory nerve, and then the conjunctiva. then the conjunctiva. All right. Deficiency of terminal complement factors. We know C5 to C9 9 का factors का deficiency होगा. It will cause toxoplasma gondii, risk of toxoplasma gondii and Neisseria. Or what are the points we read? Q1 is that they are capsulated. Most common serogroup is A, and pili they are having outer membrane protein endotoxin activity. Humans are the reservoir, carriers are the humans, and the mode of transmission is the droplet, and most common age group is what, children's, and most common route is what, hematogenous, then the olfactory nerve, and the C5 to C9 factors, late complement factors की अगर deficiency हुई, this will lead to increased risk of what, Neisseria and the toxoplasma gondii. Therefore, outbreaks in the Hajj pilgrimage in 1919 due to this Neisseria, and it is high prevalence in the sub-Saharan area. The seasonal variation in winter we see, and the risk factor is poor hygiene, overcrowding, because it is actually through the contact, through the air, it is through the droplet infection. Mode of transmission is was droplet. So, overcrowding area, smoking, and the other respiratory tract infection. Fatality is highly fatal, and what is the fatality rate? It is around 80%. It is around 80%. Now, clinical features, we need to remember the rash. Clinical features are what, rash, and rash is what, non-blanching rash. कैसे होते हैं rash? Rash होते हैं non-blanching, non-blanching rash. ठीक है. Now, another is important, fulminant meningococcus. We need to remember the multi-organ failure and the complication, that is M को उल्टा करेंगे तो that is Waterhouse Friderichsen syndrome. All right, this is nothing but it actually hemorrhage in the bilateral adrenal glands, causing what, rashes and the shock, and it was mainly due to what, endotoxin activity. क्यों? क्योंकि ग्राम नेगेटिव है, and gram negative is having outer membrane having the endotoxin, causing endotoxin activities and causing the shocks. All right. So clinical feature one is a rash, and rash कैसे है, non blanching rash. Rash is a what, non blanching rash, and for Waterhouse Friderichsen syndrome. Now moving next, this is nothing but you can see the hemorrhage in bilateral adrenal gland, which is what, Waterhouse Friderichsen syndrome. Now, meningitis is common in 3 to 5 years of age, and the chronic meningococcemia, that is repeated episodes of rash, and post meningococcal reactive disease, that is immune complex disease, develops later, which manifestations will occur. So meningitis, chronic meningococcemia, and the post meningococcal reactions. Diagnosis, we know for the Neisseria it is what, chocolate agar, chocolate agar, Muller's Hilton agar, and Thayer Martin media. Thayer Martin media. Please remember, very important media is what, Thayer Martin media. Transport media is what, Stewart's media we remembered by the mnemonic, that is Neisseria, that is that for Neisseria, Amy's transport media and Stewart's transport media. Sample we collect from the CSF, from the blood, and from the nasopharyngeal swabs for the carriers, and we'll check for the LDH and the neuraminidase and the antibody retrospective. What is the treatment? Treatment is same for both Neisseria, that is C4-taxim and ceftriaxone and cefotaxime. All right. Now, coming very important topic, that is a vaccination. Vaccination has been developed for the meningococcus, and what is the dose is around 50 microgram, and single dose is given. All right, that will last, effect will last for 3 years. But what is the key point we need to remember, that Group A meningococcal polysaccharide vaccine is effective in preventing at all the ages. At all the ages. All right. So meningococcal polysaccharide vaccine for A is effective in preventing disease at all the ages, but it is not useful in below 3 years of age. There is no vaccination that is available for the group B. Why? Because group B is poorly, capsule is poorly immunogenic. Is what? Poorly immunogenic. Okay, and it is made up of salicylic acid. So the key points that we need to remember is that vaccination is available, polyvalent vaccine is available, but for the group B vaccine is not available because of poorly immunogenic capsules. And group A vaccine that is available is preventive to all the ages, but vaccine is not contraindicated. Vaccine is contraindicated in pregnancy as and is not used for children less than 3 years. Talking about Neisseria gonorrhea. Okay, now it is based on the phyla. They are divided into four types, and intraspecies typing is done by the oxotyping. And phyla is important role of an attachment. One of the most important role in the virulence is by the phyla, and it is also consisting of the outer membrane proteins, that is protein 1, 2, and 3, that is serving as a basis for the serotyping. IgA1 protein is also present here and the lipo-oligosaccharide. Apart from this, they also have what? Transferrin, and lactoferrin binding proteins. That is transferrin and lactoferrin binding proteins. Please remember the most violent factor is what? Pili. Alright. Now, the babies that are born to infected mother, they will show ophthalmia neonatum. Now, the question arises that ophthalmia neonatum is due to the chlamydia trachomatis. But when in the question it is asked that within first 2 to 5 days, it is by what? Neisseria, gonorrhea, and after 1 week, it is by the chlamydia. It is by chlamydia. Okay, it is by chlamydia. All right, and it will cause the septic arthritis in the children, and the most common joint that is involved is what? Knee. And male, please remember this, very important. What is the most common manifestation in the male? It is what? Urethritis. It is what? Urethritis. It is what? Urethritis. All right. Now, female, it is what? Cervicitis and pharyngeal gonorrhea following the orogenital sexual exposure, and anorectal that is seen where in the homosexuals. In the homosexuals. So we need to remember that ophthalmia neonatal within the first 48 hours and within first 2 to 5 days and causes the septic arthritis, and the most common manifestation in the male is what? Urethritis, but it doesn't involve the testis. It doesn't involve the testis. With apart from the testis, it may even involve all the the sexual organs, but not the testis. Female, it is causing what? The most common manifestation is what? Cervicitis. Cervicitis. Now, one is DGI, that is the deep gonococcal infection, and it is nothing but polyarthritis. Polyarthritis. Okay, we saw that the gonorrhea is involving what? It is mainly through the sexual route it is being transmitted and causing urethritis, cervicitis, and the arthritis. And if it is causing polyarthritis, this is deep gonococcal infection, and risk factors are what? Menstruation, menstrual wounds, and late complement deficiency. Late complement deficiency, that is C5 to C9. Complication here is what? Fitz-Hugh syndrome, Fitz-Hugh-Curtis syndrome, and water can perineum. ठीक है, वहां पे क्या था? One was in the Neisseria meningitis. It was हमने M को उल्टा क्या था? W, that is we remembered the complication. All right, there's a Waterhouse Federation syndrome, and in the gonorrhea G4G, that is Fitz-Hugh-Curtis syndrome, and it is commonly seen with blood group blood group B. With blood group B. All right. This Fitz-Hugh-Curtis syndrome, we can see the violin strings-like appearance, that is perihepatitis, and intraperitoneal exudates causing the violin strings additions between the liver capsule and the peritoneum, causing what? Perihepatitis. All right, gonorrhea in the female, what's the most common manifestation is what? Cervicitis, and in the male, it is what? Urethritis. And here we are talking about the gonococcal urethral discharge. But what is the most common cause of non-gonococcal non-gonococcal urethral discharge. What is the most common cause? Is what? Chlamydia. What? Chlamydia. Is what? Chlamydia. What is the lab diagnosis? We'll take the urethral discharge, we'll take the swabs and the rectal swabs, and for the blood culture and the synovial culture for the deep gonococcal infections. Transport media is same, that is what? Neisseria, that is Amy's transport, and the Stewart's transport media. Alright, for longer holding period, CO2 generation system can be used. For the males, gram staining, the urethral discharge is taken, and the gram staining that we'll see the diplococcus, that is a gram positive diplococcus in the female. The gram staining is less sensitive due to presence of what? Camels and Neisseria species in genital tract may confound with interpretation. So endocervical culture is recommended. Therefore, we take the endocervical culture. In the males, we take the urethral discharge, and in the females, we take what? Endocervical culture. Culture media in acute gonorrhea is chocolate agar and the Muller's Hilton agar. And what is the selective media? This Thayer Martin media. What is the selective media? This Thayer Martin media. Apart from this modified Thayer Martin media, containing what? Thayer Martin media is what? Having what? VCN, that is vancomycin, colistin, and the nystatin. Alright. Gonococcus are more difficult to grow than that of the meningococcus. Alright, so where were we? Now, selective media were Thia-Martin media, modified Thia-Martin media, modified New York, and modified Martin Lewis. But we need to remember most important, that is the Thia-Martin media having the VCN, that is vancomycin, colistin, and the nystatin. It is selective media that is inhibiting the growth of other bacteria and promoting the growth of the Neisseria. All right. What is the treatment? Treatment is same, that is the cefotaxime, and ceftriaxone, cefotoxin and ceftriaxone. All right, what is the drug of the choice? That is a cefotaxime and the ceftriaxone, and both the partners shall be treated because it is a sexually transmitted. So both the partners has to be treated, and also include azithromycin for that of the chlamydia. All right, so it was a short session. In the next short session, 15 to 20 minutes, uh, we'll just cover up the questions of the Neisseria. Now, please do use my code, that is Muskan 10, to get 10% of the discount. All right, and do like, share, and subscribe the videos, and please do share it. And we'll cover the Neisseria questions in the next 15 to 20-minute sessions, because so short sessions are easy to watch and easy to remember. Therefore, I'm making this short session for you guys. So I hope that you liked it, and I will see you soon, specifically on the 10th of October at 11 p.m. Because please do attend the NEET PG Combat Scholarship and use my code, that is Muskan 10, to get this enroll into the Unacademy and to enroll into examination. So that you can get the scholarship, and also you can analyze your performance, because scholarship is something that is will be available to you once you perform good in the examination, and you will just 1 hour examination with 60 MCQs, and don't forget to attend it.